Hi, my name is Brooke Bruce, and this is my second attempt for my injectable checkoff. For intradermal injections, the needle length is going to be 1/4 to 5/8 inch, and the gauge is 25 to 30. The maximum amount of medication that you can put in intradermal is going to be 0.1 milliliters. And then some locations are going to be the ventral surface of your forearm, your upper chest, and your upper back. And the process for injection is you pull the skin taut to the side, you insert the needle just so with the bevel facing up, and you insert it just so the bevel is covered about 1/8 of an inch, and then you inject, and you're looking for a wheal or a bleb underneath the skin. For subcutaneous injections, the needle length is going to be 3/4 to 5/8 inch, and the gauge is going to be 25 to 30. The maximum amount of medication you can put in is 1 milliliter, and then some locations are going to be your anterior thigh, the back of your arm, lower buttocks, which is your upper buttocks, lower back, and then in your abdomen at least 2 inches away from the umbilicus. And the process for injection is the PERM method, so you pinch the skin, you inject, release, and medicate. And when you're pinching the skin, if you pinch more than an inch, then you're going to inject at a 90-degree angle, and if you pinch less than an inch, then you go in at a 45-degree angle. For intramuscular injections, the needle length is 1 to 1/2 inch, and the gauge is 20 to 24 gauge. The maximum amount of medication depends on the site. So the deltoid, you can put 1 milliliter max, and then the ventral gluteal and the vastus lateralis, you can put 2 milliliters max because they're bigger muscles. The locations I'll go over in a minute on my model. And the process is use the Z-Track method. So when you inject at a 90-degree angle, and you displace the skin to the side. You inject the needle, you medicate, you take out the needle, and then you release the skin back to its normal position. And then before you actually inject the medication, you have to aspirate. So pull up on the needle, or pull up on the syringe a little bit, the plunger, just to make sure there's no blood, to make sure you're not in a vein. So if there's no blood, then you go ahead and inject. If there's blood, then you take out the needle, and then you pick a new location or a different spot in that location. For injection sites, we're going to start with the deltoid, and you locate the acromion process, and you put 3 fingers below that, and you do a V, and then you inject right in the middle of your knuckles. For the ventral gluteal, since she has her left hip facing me, I'm going to ask her to pop it out a little bit. I'm going to put my right hand on her hip. Can you go that way a little bit? Pop your hip up. My right hand is on her hip. And I'm going to find her greater trochanter, which is right there. I'm going to put my palm of my hand on her greater trochanter. My pointer finger is going to be pointed toward her anterior superior iliac spine. And the rest of my fingers are pointed toward her iliac crest. And then I inject right in the middle of my knuckles there. And then vastus lateralis. Again, I find the greater trochanter. And then I make a little rectangle with my hand. And then I locate her lateral femoral condyle, and then I make the other half of the rectangle, and I inject in the middle third. So I would inject right there. Okay, so now for my 3 medication checks. I'm going to start at my nurse's station. I have my MAR here. I have my patient Manny Stickens. Birth date is 12/15/XX, and he is allergic to penicillin, and there's none of that on my MAR. I'm giving 9 o'clock meds, so I'm going to head with the first one is my training ampule. 0.1 milliliters IM daily, due at 9 o'clock, and it's 9 o'clock. Have my training ampule here that I'm getting from my Pyxis. Training ampule, demi-dose amp, 2 milliliters. Expiration date is 05/2026. This is not expired. There's enough for my dose, and it's due at 9 o'clock. For my insulins, I have first my Practi Regular insulin, 4 units subcutaneously twice daily with meals. First one due at 0900, and it's 0900. Have my regular insulin here. Practi Regular insulin, there is enough for my dose, and this is not expired, 05/2026. For my NPH insulin, 14 units subcutaneously twice daily with meals, due at 0900. It's 0900, this is my NPH. There is enough for my dose. Practi NPH insulin, and then it is expired 05/2026, so that's not expired. For my Practi Tub PPD skin test, 0.1 milliliters intradermal times 1 dose now. That's my now order, so I'm safe to give that. So Practi-Tub PPD skin test, there's enough for my dose in here, and this is not expired. So now I'm going to move on to my nurse's station, and I'm going to start, going to do my second check, and then I'm going to start pulling up the meds. So, first one is my training ampule, 0.9 milliliters IM daily, and this is my patient Manny Stickens, birth date 12/15/XX, allergic to penicillin. So the first one was that training ampule. So I have training ampule. There's enough for my dose, and it is not expired, and it's due at 0900. Prati regular insulin, 4 units subcutaneously twice daily with meal, 0900. Prati regular insulin, enough for my dose, and this is not expired. Practi NPH insulin, 14 units subcutaneously twice daily with meals, due at 0900. Practi NPH insulin, this is enough for my dose, and it is not expired. Practi-Tub PPD skin test, 0.1 milliliters intradermal times 1 dose now. Practi-Tub PPD skin test, this is not expired, and there's enough for my dose. So now I can start pulling up medications. All right. So the first one I'm going to pull up is my training ampule. So I'm going to go ahead and make sure there's no medication in the lid of the ampule. And just so you can see what I'm pulling up. Training ampule. All right, so I'm going to break the top of the ampule away from my face or anybody else's face. Okay, and then I'm going to put the lid into sharps. And then with withdrawing foam in an ampule, you need to use a filter needle or a filter straw. And I have a filter needle with me. And then I have to pull up all the medication at once, and then I can now touch the sides of the ampule so I don't contaminate it. All right, put this aside real quick. I'm gonna put the filter needle in the sharps container. And then I'm gonna put on the intramuscular needle, which is 1.5 inches. And this is when I can get out air bubbles and get my correct dose. I'm going to get rid of the excess medication per facility policy. So I need 0.9 milliliters. All right, and then just so you can see the dose and what I pulled from, it's my training ampule, and the dose is 0.9 milliliters. So, I'm going to recap this safely, and then I can label. So looking off my ampule, I have training ampule. My dose is 0.9 milliliters, and the expiration date is 05/2026. Now I can put the ampule in the sharps container. For my insulins, I need 4 units of regular and 14 units of NPH. So I'm going to pull up 18 units of air total. And then I'm going to use the Nicole Ritchie RN method and pull up NPH regular, or put the air in NPH regular and then pull up regular and then the NPH. So I'm going to clean the lids of the insulins for 30 seconds. Okay, 30 seconds is up. And another for the regular. It's been 30 seconds. And then with NPH, you always want to roll the vial to make the whole mixture cloudy because there is sediment at the bottom. Oop. I'm going to clean that top again since I just dropped it. For 30 more seconds. 30 seconds, okay. So now I can pull up my 18 units of air. And I'm going to inject 14 units and NPH. And then the leftover 4 in the regular. And then pull up the regular 4 units. Make sure there's no air bubbles in there. Okay, so that was my regular. And then since this is a high dose or a high risk medication, you have to get a second RN to look at your dose. So I don't know if you can even see. 4 units, and then I'm going to pull up my 14 of the NPH. So I'm going to stop at 18 total. That was the NPH. And make sure there's no air bubbles. So you have 18 total units there. All right, I'm going to recap this safely. And then label. So going off of my vials, my Practi regular. I pulled up 4 units of regular. And then the expiration date is 05/2026. And then for NPH, Practi, NPH, insulin. I pulled up 14 units. And this expires 05/2026. All right, and then my last one is my skin test. So I'm going to clean the top of my vial for 30 seconds. So 30 seconds. I'm gonna get my intradermal needle. And I'm gonna pull up, I need 0.1 milliliters. So I'm gonna pull up 0.1 milliliters of air. Inject that into the vial, and then pull up my dose. Okay, and that was my Practi skin test. I'm gonna make sure there's no air bubbles. Okay, recap it safely. and label. Practi Tub PPD skin test. My dose is 0.1 milliliters and the expiration date is 12/20/21. Okay, so now I would return all of my medications to the Pyxis. And now I'm ready to go into my patient's room. Hi, Mr. Stickins, how are you today?
I'm good, how are you?
Good. I'm gonna give you your 09 o'clock medication, or your 0900 medications, which are your shots today. Can you verify your name and date of birth for me?
Manny Stickins, 1215XX.
And do you have any allergies, Manny?
Yeah, I have an allergy to penicillin.
Okay, we will not be giving any of that to you today. All right, I'm just gonna take a second. I'm gonna go through my last medication check here just to make sure I have all the right stuff for you. So my first one is my training ampule, 0.1 milliliter IM daily, due at 0900. Training ampule, 0.9 milliliters. It is not expired and it is due right now. Insulins, I have Practi regular insulin, 4 units subcutaneously twice daily with meals. First one at 0900. Practi regular insulin, 4 units. It's not expired and it's due at 0900. Practi MPH insulin, 14 units subcutaneously twice daily with meals. 0900. Practi NPH insulin, 14 units, and this is not expired. And it is 0900. For my now orders, I have my Practi Tub PPD skin test, 0.1 milliliters intradermal times 1 dose now. Practi Tub PPD skin test, 0.1 milliliters, and this is not expired. Okay, Mr. Stickins, do you remember where you got your last insulin shot?
Yeah, I got it in my, the back of my left arm.
Okay, we're gonna do it in your right arm this time. That's okay. And then do you have a preference for the order I go for your shots?
Nope.
Okay, so we'll start with your intramuscular injection, and we'll do it on your right ventrogluteal, which is your right hip if you don't mind. All right, so I would locate his right ventrogluteal. I'm gonna clean his skin from, in circles from inside to outside. I'm gonna displace his skin, Z-Track method. I'm gonna displace the skin to the side. Go down at a 90-degree angle. Aspirate, and if I don't see any blood, which I don't, I'm going to inject. Pull it out, and then I'm going to replace the skin to the original position. This now goes in sharps. And then now I have my insulin, and I told him we're gonna do it in his right arm, so this is my insulin. I'm gonna clean the skin. Okay. And then, since I pinch less than an inch, we're gonna go in at a 45-degree angle. So I'm gonna pinch, insert, release, and medicate. This now goes in sharps. And then for my skin test, I'm gonna do it on his right ventral forearm. So clean the skin. I'm gonna pull his skin taut to the side with bevel facing up. I'm gonna go in at a 5 to 15-degree angle. And just so the skin covers the bevel. I'm going to inject, and I'm looking for a wheal or a bleb, which I do see. This now goes into sharps, and now I can document. So I can make sure that everything in his room is safe. His collate is in his reach. I'm gonna document right now. Okay. Okay.